Thank you so much for joining, though. This morning, we're going to talk about Neurogen brain balancing, what that is, and how it can be used and applied for PTSD and concussion care. A little bit about myself. My name is Dr. Doug Wingate. I'm an integrative neurorehabilitation specialist. I've been in clinical practice for 15 years. Most of my clinical experience and clinical focus has been on post-concussion brain trauma, and with that, often PTSD comes into play. It's a very common comorbidity, so those two things often come coincide. And as we'll see, there are also a lot of similarities between those two things, and the lines kind of blur a lot of the time. So I've worked with extensively with both of these conditions for many years, and neurogen brain balancing is something relatively recent that I brought into my practice and have seen just real significant gains with this application, and definitely in conjunction with other modalities of other therapies that I bring in. So my doctorate is in traditional Chinese medicine. I'm a licensed acupuncturist. My postdoctorate is in clinical neuroscience. I'm also a functional medicine hyperbaric clinician, so we use hyperbaric oxygen therapy often in my practice, photobiomodulation, different means of non-invasive brain stimulation, functional medicine exercises, supplementation, and things like that. Neurogen brain balancing has been really a game changer. Hyperbaric oxygen therapy, when I started bringing that in, that was a real game changer as well. Neurogen is a very accessible therapy, and we'll see exactly why, and how I've seen this to be helpful for many of the people that I'm working with, experiencing post-concussion syndrome, concussion type symptoms, traumatic brain injury, acquired brain injury, and certainly with PTSD as well. So before we get into the meat of things, just a little bit of a disclaimer that everything that we're gonna be talking about here is for educational purposes. So don't take it as a prescription for or a treatment regimen for any particular disorder, disease, symptom cluster, anything like that. But to consult with your healthcare provider, your mental health practitioner, in terms of whether or not this might be right for you or right for somebody else. Um, but that being said, neurogen brain balancing. What it is it's a passive form of neurofeedback. So it's been described as a novel, passive, non-invasive neurobiomodulation modality for brain health. What that means is that it works to optimize brainwave function and restore neurological balance. It's an intervention that uses, it's EEG driven. So the neurofeedback is a means of using EEG, getting real-time readings of what the brain is doing. So you use multiple wires, multiple leads over different areas of the scalp to read what the brain is doing. And based on that information, we're able to design a treatment, or in the case of Neurogen, it's entirely passive. So, conventional neurofeedback, usually you're getting information from the EEG, and then the person is engaging with some sort of screen or auditory tone or something like that. And it's a therapeutic exercise where the person engages with that information in order to retrain the brain. Neurogen does that on its own. It's completely passive for the person getting the treatment, so they don't really have to do anything other than show up, be in the chair, and let me as the practitioner get everything all set up. And the system, the software, does its thing, takes a real-time reading and responds to that in real time as well, applying the therapy through a low intensity pulse transcranial electrical signal. So what that means, it's a very low electrical signal that's a particular frequency. That frequency is an offset of the information that's coming in through the EEG. So you're getting this real-time adaptive feedback that's happening where the system is reading the brain waves, the different levels of brain waves that are constantly operating within our nervous system. So your alpha, beta, delta, theta waves. And based on that information, the system analyzes that, determines where communication is not properly happening, or where there's incoherence in the nervous system, or there's dysregulation. And offsets a frequency based on the frequency that's coming in, and gently guides the brain back into coherence. So it takes that offset and then modifies that in real time based on how the brain is adapting. And so it's this constant feedback of information based on what your brain is actually doing as you're receiving the therapy. In that sense, the passive nature of not having to do anything takes a large load off of the patient or the client, and certainly in situations where there may be brain trauma, or a very active nervous system, sometimes engaging with screens and engaging with audio tones. People can be very sensitive to light or screens, and those things can be overstimulating or even hypersensitivity to sounds as well. And so Neurogen makes it a really appealing option for people, especially with sensitivities or who may not otherwise be able to engage with conventional neurofeedback. So in that description, it says a novel passive non-invasive neurobiomodulation modality. And what does neurobiomodulation mean? It means that it applies to the nervous system, the neuro portion of it. It means that it can also be applied to the body or biologically. And in that sense, this Neurogen can be applied to different body areas as well. So that I've utilized it and seen it used everywhere from the shoulder to the back to the neck. The neck can be really important when it comes to proprioceptive feedback. And so when you have things like vestibular issues, balance issues, vertigo, things like that, the neurointegrators that are in the back of your neck. If there's a lot of neck tension, that can throw those off. It can throw back off the feedback that's going into the vestibular system. So the system can not only be applied to the scalp and take EEG readings, but the low level electrical frequency can also be used therapeutically over the body. So neurobiomodulation, and modulation is the ability to introduce change or adaptability into the system. So, according to the International Neuromodulation Society, neuromodulation by itself is technology that acts directly on the nerves. It's the alteration or modulation of nerve activity by delivering electrical or pharmaceutical agents directly to a target area. In some of my other talks about some of the other therapies that I do, things like photobiomodulation, which is the use of cold therapeutic lasers, or with acupuncture as a means of modulating the nervous system. Those would also fall into what would be considered neuromodulation. Now, neurobiomodulation is a fast evolving field that harnesses low intensity electrical impulses in order to regulate and restore neuronal activity. It targets maladaptive brainwave patterns supporting neuroplasticity, and we'll talk about neuroplasticity. The brain, but briefly, it's the brain's ability to reorganize itself through neural pathways. Now, I want to emphasize with neurogen brain balancing that even though a mild electrical signal is being used, it's not anything that people feel. It's a very low level. The frequency is very specific, which is why it's so effective because it's adaptive to the person's own nervous system and where their brain is at, and it really doesn't take much in order to receive that signal, integrate that in, and allow for that change to happen or that re-regulation of the nervous system. People who might be really sensitive to sensation, sometimes people who have a history of stroke, may feel a mild sensation, just like a mild buzz during the therapy. Most people don't feel anything at all. It's such a low intensity. I kind of touched on this, but one of the key advantages is an accessibility to the therapy. So the passive nature of Neurogen makes it particularly suitable for people who might struggle with other modalities like conventional neurofeedback that require active participation. That can be psychotherapy, so the ability to even verbally convey their situation. That is sometimes a hindrance or a barrier to therapy. as well as the traditional neurofeedback due to cognitive overload, trauma, or attentional impairments. Again, that certainly includes sensory overload as well. So, um, just it being too much sensory information coming in all at once, which can um, cause acute emotional dysregulation or acute cognitive dysregulation, but can also be really fatiguing because it can be too demanding for the nervous system if somebody's nervous system is compromised or just already under high demand because if they have a history of brain trauma. The brain is a very energy expensive organ, the most energy expensive organ in the body. And it takes a lot to heal that while also trying to function and do everything that the brain typically does. Um, Additionally, Neurogen has a minimal side effect profile. Some people after a session, especially as we get rolling, might experience a very short period where they might feel a little wobbly or a little bit of dizziness or possibly a little bit of nausea. It usually passes in 10, 15 minutes if that is the case. Most people tolerate it extremely well. It can impact dream activity after a session. So a lot of the information, a lot of the therapy itself is integrated during the REM cycle of sleep. And because of that, people have reported that they'll have more dream activity or their dreams will be more vivid than typical following a session. But other than that, the throughout the research that's been done, in my own clinical experience, very minimal risk of side effect, very safe modality, which also has great appeal and is definitely helpful for some of these situations, especially when you're working with a compromised nervous system. So neuroplasticity was mentioned before. Uh, Neuroplasticity is really a key element when it comes to any sort of neurotherapy or neurorehabilitation. It's the brain and the nervous system's ability to change and rewire itself. So it's the ability to create new neural connections and establish new patterns within your body, within your brain, within your nervous system. It's the capacity to modify its activity in response to uh, stimulation or stimuli from both internally, so what's going on inside of the body, and externally in the outside world, by reorganizing its structure, the functions, and connections. Understanding and harnessing neuroplasticity have significant implications for developing therapeutic strategies that are aimed at enhancing cognitive function, learning, memory, and facilitating recovery from neurological disorders. So neuroplasticity comes into play in a lot of different realms, as you can see, especially when it comes to cognitive function, learning, memory. Those are some of the areas where, as we're learning more about neuroplasticity and how it continues throughout our lifetime, it's previously thought that the brain develops and it creates a lot of new neural connections as we're growing up, and as we reach adulthood, it kind of stops. And any injury that might happen to the brain, that function is lost, and we're kind of stuck with the brain that we have from 15 or from 18 or 25 on or so. We now understand that neuroplasticity continues to a limited capacity, not nearly as much as during those developing phases. But there are certain areas of the brain that continue to very actively uh, continue to have this neuroplasticity to create these new neural connections. A couple of those are the memory centers of the brain, so the hippocampus, and the olfactory bulb, which is associated with our sense of smell. And that adaptive neuroplasticity is also a thing. And so when neurotrauma happens, or situations happen, or we continue to learn, the brain does continue to change and adapt and create new neural connections. And this is really just in the last few decades that we've come to understand this more and more. Um, Therapeutics that are geared toward neuroplasticity lend themselves to allowing for this higher adaptability or this ability to learn um, or increase functionality. So by enhancing synaptic efficiency and promoting neuroplasticity through Neurogen, these therapies support functional connectivity in the brain Improvements in that potentially reversing maladaptive patterns observed in things like PTSD, traumatic brain injury, which is TBI, and chronic pain disorders. And chronic pain, chronic migraine will be talked about in my next talk. So if you're interested in that, sign up for it and join me for that. Um, Another component of what neurogen brain balancing is able to do is it's not working in isolation. It's not working on just one particular brain area. So if we know that somebody has a stroke or an injury to a particular area of the brain, we can definitely focus in on that. But as we come to understand and refine our understanding of neuroscience, the brain doesn't operate in isolated areas. The brain is vastly interconnected. It talks to each other, and there are certain networks within the brain that have a tendency to all talk to each other. So, for instance, there's an intentional network, there's a visual network, there's what's referred to as the default mode network, which has a lot of our association with our sense of identity, our sense of self, and sort of our baseline operational, um, the way that we operate throughout our daily life. And the central executive network is an example of when we are engaged in novel activity or actively engaged in something. And there's kind of this back and forth yin and yang relationship between the default mode network and the central executive network. Um, the point being that we have these areas of the brain that communicate with each other, and more therapeutics and our understanding of neuroscience is taking a look at the brain in terms of networks and intercommunication. And Neurogen allows us to take that into consideration, and we're able to create therapeutic strategies that don't necessarily focus in on one area. A great example of this is with the visual system. So if somebody has a concussion and they have visual problems after that, which is very common, visual problems can lead to all kinds of other issues. It's very energy expensive to take in a lot of visual information and constantly be tracking, and our eyes are doing a lot and taking in a lot of information. So that can lead to fatigue. It can lead to eye strain. The eye strain can lead to headaches and chronic migraines. It can also cause all kinds of vestibular issues and dizziness and things like that if our eyes are not tracking or taking in information effectively. So we're able to the visual cortex in the brain, or the visual center of the brain, is toward the back in the occipital lobe, but the visual system is also vastly interconnected with other areas of the brain. The visual information that comes in is processed in different areas, and then what we do with it, how we use that information, is used in different areas as well. So with neurogen brain balancing, we're able to work multiple areas both simultaneously and within a single session. So we can move from the occipital lobe to areas like the frontal eye fields and the supplementary eye fields that are more toward the front of the brain, but process that visual information. We can add additional leads so that all of those are being stimulated at the same time, creating a networked effect. Or we can move from one to another. So we can work that visual cortex and make sure that it becomes re-regulated, and then move to other areas like the frontal eye fields, and make sure that those become regulated, but still within the same session so that all of that information gets integrated in together. It's just not necessarily simultaneous. And there are different reasons why you might do simultaneous versus one after another. But um, fortunately, a very nice thing about this system is that we can take that into consideration and create more elegant and refined treatment approaches that are personalized for where somebody is at. Because again, this is all adaptive and it's all EEG based. It's all based on where the brain is at in that very moment and how it's communicating or not communicating effectively. Um, some research with PTSD and mild traumatic brain injury patients have shown abnormal slow wave activity in an area of the brain called the amygdala, the hippocampus, and the prefrontal cortex. The amygdala is deeply tied into a lot of our emotional reactions, especially with PTSD. There's a strong correlation with this area, the amygdala. Um, it's associated, usually gets talked about in terms of our fear response or our our startle response. So when we're very hyper vigilant, often the amygdala comes into play. It's tied into other emotions as well, but it's really well known as kind of the fear center of the brain. The hippocampus, again, is the memory center. Memories can be deeply impacted by PTSD and emotional trauma. And the prefrontal cortex is the frontal area of our brain where we do most of our higher cognitive processing, our thinking through, and rationalization and things like that, which can also be um, very impacted, as we'll see with both PTSD and post-concussion. So they found this abnormal slow wave activity in those areas of the brain that correlates with impaired emotional regulation and cognitive dysfunction. There was a study that took a look at this, and following treatment with low intensity pulse stimulation with neurogen brain balancing, and they took a look at this using different diagnostic tools. So MEG is a magnetoelectrogram, and a QEEG is a qualitative EEG, which is taking a overtime reading of what the brain activity is. These scans revealed a significant reduction in pathological slow wave activity that suggested that the interventions restored dynamic balance in brainwave oscillations. And again, as a practitioner, I'm able to see this in real time. We have a screen that shows us what's going on, and we can see as the brain is coming into more coherence or as these are more into balance, which allowed for improved executive function, which is our ability to multitask and make judgments and take in a lot of information and figure out what to do with that. So, a common term when it comes to both PTSD and post-concussion syndrome is executive dysfunction. That executive function is not operating well. It can be significantly impacted by these conditions, by these states. So there was improvement in executive function, in emotional stability, and cognitive processing. And where relevant, I went ahead and included the studies. So if you're interested in looking these up or digging deeper into the information, you're more than welcome to. And this will be recorded. You'll have access to the recording. And if you want the slides themselves, reach out at the end, and I'll send them to you. So. Um, a couple of the mechanisms by which neurogen can be helpful, we'll go through. One of them is neuroinflammation modulation. So the ability to change inflammation in the nervous system is what that basically means. Chronic neuroinflammation is implicated or involved in neurodegenerative disorders. So this gets talked about a lot when it comes to everything from multiple sclerosis to Alzheimer's disease to things like Parkinson's and motor disorders as well that are neurodegenerative. They tend to degenerate over time or become worse over time. Um, so chronic neuroinflammation is in play there, also with traumatic brain injury and persistent pain syndromes, often resulting from glial cell activation. Glia is are small cells in the body. It is basically the glue that helps with communication through the nervous system and through the brain. And excessive cytokine release. Cytokine is our inflammatory mediators or components of inflammation. So neuromodulation technologies are thought or hypothesized to reduce neuroinflammatory responses by influencing microglial activity and cytokine expression. It's directly impacting, so that's kind of the mechanism through which it's influencing neuroinflammation, thereby mitigating the neurotoxic effects of prolonged inflammation. So, in short, it's able to reduce inflammation in the central nervous system. And this picture that we have here is actually what's referred to as patient zero with neurogen brain balancing. The developer of the system had QEEG readings. He is a military veteran who experienced a fair amount of PTSD and dysregulation and history of concussion as well. And so took readings before and after treatment, and you can see the description here if you're really interested. Um, Basically, what they found is that there was a lot more balance in the nervous system overall, and that inflammation went down following several sessions. I think it was 10 sessions in this case. So it's able to directly reduce inflammation in the nervous system itself, which can be a huge issue with these kind of conditions. It can also be helpful with autonomic nervous system regulation. So the autonomic nervous system can become very influenced or activated after any sort of physical or emotional trauma. So with PTSD and concussion both. Dysregulation of the autonomic nervous system is commonly found in PTSD, chronic pain, stress-related disorders, and can contribute to hyperarousal, persistent pain perception, and emotional dysregulation. If you've heard about vagus nerve stimulation, the vagus nerve is a cranial nerve that feeds into and helps regulate the autonomic nervous system. So we're able to do that with Neurogen as well. That it is a system that lends itself to stimulating the vagus nerve. The vagus nerve. There are a number of other interventions out there and wearable devices or therapeutic devices to work with the vagus nerve directly. Transcranial stimulation therapies have been proposed. So therapies that work on the scalp or the head, across the head, such as Neurogen or neurofeedback. They've been proposed to influence the autonomic nervous system or the ANS through vagal nerve modulation, promoting a shift from sympathetic overactivation. So when we're in locked in fight or flight response, when we're very activated or hyper aroused, that's sympathetic overactivation. Our sympathetic nervous system is overactive. It's what responds to stress. It's what responds to threat. And what can happen is that our body gets locked into this cycle of constantly being hyper aware or constantly thinking that it's in danger or there is imminent threat. And that is being locked in a fight or flight response. And the opposite of that, when our body moves out of that, is an activation of the parasympathetic nervous system. So a shift from sympathetic overactivation to parasympathetic dominance, where the body is much more focused on resting and digesting. So it allows when we're caught in fight or flight, or we're very um, or we feel threatened, the blood shunts away from our digestion system and we don't digest things very well. And so digestion issues can also show up very often when we're caught in this fight or flight because it's not getting blood flow, it's not happening. So as if we can promote a shift to the parasympathetic nervous system working better, the body focuses more on being able to rest, rejuvenate itself, as well as more focused on digestion. So the observed reductions in PTSD-related hypervigilance, migraine frequency, and emotional instability suggest a beneficial effect on autonomic homeostasis, which means it's re-regulating the autonomic nervous system or allowing the autonomic nervous system to really re-regulate itself, which with this therapy is also the the goal of therapy when it comes to the brain and the entirety of the central nervous system is that it is guiding the brain back into the ability to re-regulate itself. So it's not thought of as an ongoing therapy that somebody does um, continually, but that they may have a cluster of treatments in order to sort of break out of cycles that the central nervous system has gotten caught up in, or these patterns of hypervigilance or these patterns of inflammation, being able to break out of those and guide the brain back into regulating it itself in a proper way. So PTSD and TBI, why am I talking about these things in the same talk rather than having separate talks? It's because there are a lot of similarities and there's a lot of overlap between them. Everything from symptoms that people experience to the neurobiology of both conditions. Um, this this graph on the left shows symptom clusters. PPCS is persistent post-concussion syndrome. And PTSD, of course, is post-traumatic stress disorder. So you can see in the middle of that diagram things like depression, anxiety, insomnia, irritability, and anger or emotional dysregulation, trouble concentrating, fatigue, hyperarousal, and avoidance are common threads between those two. Now, you'll see under persistent post-concussion syndrome things like headache, sensitivity to light and sound, memory deficits, and dizziness. Now, those things can also show up in PTSD. They're not considered staple symptoms, but they can show up. You have a lot of PTSD symptoms, and you tighten up your body, tighten up your neck, and it can lead to headaches or sensitivity to light can certainly happen. It's been shown very well that emotional trauma can lead to and directly impact memory. Even where they're not shown to overlap, those things can play into the other disorder. Same thing with PTSD. Well, with PTSD, you have re-experiencing symptoms, feelings of shame and guilt. There's a very strong emotional impact that if you have experienced a physical trauma like post-concussion syndrome or traumatic brain injury, they have certainly can have very strong emotional impacts. It can be a life-changing event. Your life can be completely turned upside down in a matter of moments, and that's not in isolation. So the emotional impact that that has, and by the same token, with PTSD, research has shown over and over again that emotional trauma and PTSD symptoms um, have very real physical impacts on the brain and on the central nervous system, which is part of what's shown on the diagram on the right here. I'm not sure if you can read it with your screen. Again, it'll be recorded and you can take a look at it, or I can send this to you. But a lot of the frontal lobe tends to be impacted in both conditions. Um, with TBI and post-concussion, it tends to be more of an area of the frontal lobe called the dorsolateral prefrontal cortex. So it's more on the toward the surface and toward the outside. Whereas with PTSD, it tends to be more of the ventral medial prefrontal cortex, which is more toward the midline and deeper down. So if you can see it, the areas that are involved in PTSD on this brain brain image are in green. The areas that are particularly vulnerable with TBI are in red, and the areas that are typically involved in both are in blue. And so there are significant overlaps in terms of just brain structure that are affected by emotional traumas and physical traumas to the central nervous system. And so not only is comorbidity very common, many people will have both PTSD and history of TBI, but even when there is not those two things coexisting, they're impacting our nervous system, our brain in very similar ways. And so treatment protocols are very similar, even because they have an underlying similar foundation, foundational impact. This is just another diagram showing different areas of the brain that tend to be affected with both. So the diagram on the right side here, um, the ones with the black arrows on the left side of that diagram are tend to be associated with stress and PTSD. The boxes on the right with the red arrows tend to be more associated with traumatic brain injury or post-concussion. And if you can read it, you can see that there are significant overlaps there too. So PFC, the prefrontal cortex, affected by both. Hippocampus, the memory centers, affected by both. Amygdala, that emotional center, affected by both. The AAC, the anterior cingulate cortex, it's listed as affected by TBI, has a lot to do with it. It says attention disorder, and attention can be affected, but it also has to do with our sensory processing, our pain processing, and a lot to do with our experience of the emotion or our sense of suffering. And so when we feel like we are suffering, it may not necessarily be even tied into physical pain, but if we're emotionally suffering as well, that does impact or have an impact on the anterior cingulate. So there's potential overlap there as well. Um, the one that's listed for stress or PTSD, that's not listed for TBI is the hypothalamus. That's a key hormone area of the brain, hormone regulator. And hormone dysregulation is super, super common after a concussion or a traumatic brain injury. So some of the research that I've done through the Helfgott Institute um, is related to um, hypopituitarism. So the pituitary, another key hormone center of the brain, um, has been shown to shrink or not work nearly as well after a concussion or after brain trauma. And so they're looking at, and we've looked at different interventions, including administering growth hormone and things like that, to see how that impacts functionality following a brain injury. And so again, even though it's not listed on the traumatic brain injury or the brain injury side of things, hormonal dysregulation is a very common sign or symptom following brain trauma. So looking specifically at post-traumatic stress disorder, post-traumatic stress disorder, or PTSD, in particular, PTSD itself, the definition of it is an after effect of a stressful situation that can cause a chronic complex of emotional and physical symptoms in which one re-experiences an overwhelming traumatic event. So the re-experiencing of that, or having flashbacks of that event is a key component of PTSD. So this can cause intense fear, feelings of helplessness, feelings of horror and avoidance of stimuli associated with the trauma. So there can be significant avoidance. At the same time, there can be significant hypervigilance or significant sensitivity to environments. So, for instance, if you have a trauma, work with a lot of veterans, and loud sounds can be very stimulating, very activating. And so that's there's this tied in association with those loud sounds and the nervous system wanting to protect itself because there's that association with a prior experience or with a lack of safety. And so the nervous system is, again, always on edge. It's hyper vigilant around that because of that previous association. A continuation and magnification of anxiety-related symptoms that can happen with PTSD fit into three primary symptom clusters. One is that re-experiencing that I mentioned. The other is avoidance symptoms, so wanting to avoid stimuli or avoid situations that are going to be activating or bring up those traumas, or be more dysregulating. And also that hyperarousal, so that increased sensitivity to our environment or to what's going on. And again, sometimes that's emotional sensitivity, sometimes it's a physical sensitivity to things like light and sound and particular noises and things like that. Both can be in play. By definition, in order to meet the diagnostic criteria for PTSD, symptoms have to be present for at least a month and be shown to impair the individual's ability to function in social, occupational, or other important life arenas. So when we're doing research, taking a look at this with PTSD, we want to be working with individuals who have met this criteria so that we can effectively say, yes, they definitively have what qualifies as PTSD, and then be able to gauge how they respond. PTSD is a huge issue in a lot for many individuals, unfortunately. So the national prevalence in the United States is thought to be somewhere between 7 to 9% of the population. It's more common or it increases in populations with higher risk of repeated exposure to traumatic events. First responders, people who uh, are exposed to potentially traumatic situations on a regular basis, people like paramedics, firefighters, etc., it significantly increases, and it's estimated to be somewhere in the range of about 17 to 22% of individuals in those populations. If the person has sustained a head injury in addition to that, sample rates ranged anywhere from 13 to 33% developing some degree of post-traumatic stress disorder following that head injury. So again, that comorbidity component, a physical trauma has an emotional impact, and it can, depending on what the situation was, um, lend itself to PTSD, or what would meet the diagnostic criteria of PTSD. It's also higher in military personnel, as you can probably imagine. So, military personnel, it's been estimated anywhere from about 10 to 30% with combat exposure, further increasing that risk and being a primary determinant. So, those who have had time in combat, that percentage goes up significantly. Due to the increased blast injuries and head injuries of military personnel who see combat, a study showed a percentage as high as 43.9% of personnel reporting a traumatic brain injury with loss of consciousness also met the criteria for PTSD. That is huge. That's creeping up on 50% there. And blast injuries is something just in the last few decades that we've seen a significant increase in because we have improvements in body armor and with explosive devices or being exposed to blasts from explosives, the mortality rate fortunately has gone way down because we have better protections uh, for those individuals. But there's a percussive effect from being exposed to that blast that while it's not now less likely to cause a mortal wound, anything that's going to take a life, somebody may live through that situation, but it has the percussion from that blast has a significant impact on the central nervous system, on the brain. I mean, our brain is kind of locked in our skull and it has wiggle room to move around. And when there's a significant blast that hits it, then everything moves around. And that impact has been shown to not only impact the brain itself, but all of our internal organs. You know, we're mostly water. Our internal organs are influenced by that as well. And it's been shown to have systemic impacts. So while it's saving lives, people are coming back with after effects from these blast injuries because of the percussive effect in the body, and it's significant. In terms of some research with PTSD and Neurogen, there was an observational study where they had 80 veterans who completed 4 weekly Neurogen brain balancing, that's NGBB, sessions, found that 80% of individuals who went through this study reported improvements in their condition. Over 50% were no longer found to fall into the diagnostic criteria of PTSD. So it was really significant um, effects, and people seem to really benefit from this in that particular study that took a look at these 80 veterans with PTSD. So, of the people who went through the study, the most commonly ameliorated symptoms, or what people experienced the most relief from, included the PTSD symptoms themselves. So, that's the re-experiencing, the avoidance, and the hypervigilance, as well as their experiences with anxiety, depression, sleep disturbances. Often sleep can be much better regulated, or people respond very positively and tend to sleep better following their neurogen sessions. Chronic pain, cognitive dysfunction, and brain fog. So again, if you're interested in that study, it's listed there on the bottom. Very interesting read to hear about different people's experiences. There are a lot of testimonials in that paper as well. When it comes to concussion and brain injury in particular, there are a few terms that come up, and we're not going to get into these too much, but just so that you're aware that there are a lot of different terms that are out there. If you run across any of these, they all have a common thread of having some relationship to a physical brain trauma that's happened. So, acquired brain injury, or ABI, is any sort of brain injury that happens that is non-congenital. So, it's not from birth, it's not a developmental condition. And ABI is a little bit larger umbrella than what you may see more commonly, which is TBI, traumatic brain injury, which is a brain trauma as a result of some sort of physical trauma. MTBI or concussion is mild traumatic brain injury. SRC is a relatively new term that's used for a sports-related concussion. So there's research and different approaches that specifically focus on concussions in relationship to sports injuries. So that's an SRC. CTE is a whole other beast that can develop out of multiple brain traumas, multiple brain injuries. That's chronic traumatic encephalopathy. It's a neurodegenerative disorder that results from persistent or multiple brain traumas. And so that neuroinflammation becomes such a pattern or feedback loop that it becomes degenerative and continues to progress over time and become worse. Um, you'll see that talked about with a lot of people, a lot of professional athletes who have sustained a lot of concussions. So boxers or football players who have hit their head a lot of different times. DAI is diffuse axonal injury. It's where you have a brain trauma and it shears brain tissue to where it's affecting a lot of the brain, a lot of different areas of the brain. And blast injuries, I already kind of talked about. It's a shock wave from from being exposed to an explosive. Just briefly differentiating traumatic versus non-traumatic injuries. So all of these would fall under the umbrella of ABI, acquired brain injury. But some traumatic causes of brain injury that can happen can be falls is a really common one. Physical assault, motor vehicle accidents, also a very common one. Sports recreational injuries, what's now referred to as abusive head trauma. It used to be known as shaken baby syndrome. So a young child who r- sustains a head injury as a result of being shaken around. Gunshot wounds, workplace injuries, military and blast injuries, domestic violence, and child abuse can all be traumatic causes of brain injury. And I've certainly worked with all of these, unfortunately. Um, and then some other non-traumatic causes of brain injury that would also fall under ABI include stroke, seizure disorders, brain tumors, and the results of treating those tumors. So post-surgery, radiation, chemotherapy, certainly worked with all of those as well. Good number of people post-surgery for their brain tumors. They can have symptoms that they develop as a result of that invasive procedure. While again, it may save lives, it can have after effects. And I've worked with those. Toxic exposures can be anything from taking substance misuse, so taking drugs or substances or poisons, inhalation. So if you're in an environment like a carbon monoxide poisoning or something like that, or even mold exposure, which is very common here in the Pacific Northwest. Chronic mold exposure is considered a toxic exposure that has a direct impact on the body and the nervous system and can cause chronic inflammation and chronic issues and actually start impacting tissue in the central nervous system. Metabolic disorders, things like insulin shock and diabetes, liver and kidney disease, neurotoxic poisoning includes the carbon monoxide, inhalants, lead exposure, a lack of oxygen to the brain for whatever reason. So near drowning experiences, airway obstruction, hypoxia is a lack of oxygen. So if when it comes to things like abuse, strangulation can become an issue and cause ongoing brain trauma. I've worked with a number of individuals over the years who have had drowning incidences at varying ages, but often very young, and have lifelong struggles or lifelong symptoms related to that incident. Infectious disease, meningitis can do it, electrical shock or lightning strike can also fall under that umbrella. Brain injury is also a huge issue. A lot of people, even though it doesn't get talked about a whole lot, it has more over the last few decades. couple decades, but still not nearly as much as the impact that it has for millions of people. So it's estimated that over about 2 million people annually sustain some form of brain injury or concussion. About 5.4 million people living with residual effects. So they've had a history of brain trauma and then they continue to have the effects afterward. It's considered among the leading cause of death and long-term disabilities in individuals. It has a huge economic impact, about $76 billion lifetime cost for individuals in the year 2000 alone, and with an additional $137 billion in estimated value and quality of life loss, all associated with brain injury. And these numbers are the numbers that are reported. There are a lot of people who may not seek out healthcare for a variety of reasons. It can be lack of insurance. It can be sometimes it just gets downplayed. You have a concussion or a concussion um, during sports, and the old mentality of sort of shake it off still resonates and can get promoted at times. And while that conversation is evolving and getting better, and giving recognition to at the very least, getting some rest. You don't shake it off and then 5 minutes later get back out on the field or anything like that. Um, there's still a lot of situations where people may not go in and get checked up or may not get reported for whatever reason. People may rest and not really do anything professional about it. So these numbers, as huge as they are considered an underestimate of how many people actually sustain a form of brain injury or concussion. And despite all of that, it rarely gets discussed. So it's caught the label of a silent epidemic. It's a huge issue that impacts millions of individuals, but d doesn't get talked about nearly as much as it should for the huge impact that it has for a lot of people. And again, that is changing over time, especially in relation to a lot of people coming back from deployment in the military, having sustained some sort of concussion, or in the sports arena. But per the last slide, there are a lot of different reasons that people experience brain trauma. In terms of some research with Neurogen, there was a pilot treatment study for mild traumatic brain injury that took a look and did neuroimaging changes through magnetic encephalograms after low intensity pulse-based transcranial electrical stimulation. So after receiving Neurogen. It was a small study, so they had 6 individuals with mild traumatic brain injury and persistent post-concussion syndromes. And they were taking a look at the imaging and the impact that it was actually having on the brain itself. So treatments were applied twice weekly for a period of 6 weeks. The MEG exams were performed both at baseline, so before starting treatment, and afterward to evaluate the effect of the treatment on brain functioning. It focused on changes in MEG source imaging measures of abnormal low frequency activity and its relationship to changes in post-concussion syndrome. Uh, so the results showed that the baseline before treatment, all participants had some degree of abnormal slow wave signals. In the follow-up exam or the follow-up MEG, the participants showed significantly reduced abnormal slow wave in approximately the same brain areas that generated the abnormal slow waves in the baseline exam. There were significant reductions in abnormal MEG slow wave generation, strongly correlated with significant reduction in post-concussion syndrome scores after the treatment. So here they found through the MEG, through the imaging, objective changes that were happening and objective improvements at the same time that the participants reported improvement in their symptoms related to the concussion. And this is an area of research that I am working on presently as well, not this study, but getting another pilot study set up, taking a look at um, doing follow-ups with the EEG readings and wearable devices. So having them use wearable devices that gauge blood flow to different areas of the brain and doing a pre and post. So as that becomes available, be able to talk about that as well. Maybe I'll do another talk about that in particular as we get the results through. Um, these are what they found in that study. You can see all six participants. So up in the upper left corner of each scan is participant one, participant two, participant three, four, five, and six. And you can see the top three in each participant are the pre, and the bottom three are the post. And you can see areas where there's significant inflammation or impaired slow wave activity, and you can see the improvement over time as well. Won't go into the particulars of that, but again, feel free to look up the study, look into the details if that's something that you're really interested in. So that's what I have in terms of concussion, PTSD, and how Neurogen may be able to help. There are a number of other conditions that Neurogen can be helpful with and that I treat and work with. Those can range everything from dysregulation in neurodiversity, so individuals with ADD, ADHD, individuals who are on the autism spectrum respond very positively. And again, its passive nature can lend itself to working with that population really well. Addiction support, emotional dysregulation, so things like anxiety, anger. It can improve academic performance because it's increasing the functionality and the efficiency of the way that the brain is working and the way that it's communicating through itself. And by the same token, increasing academic performance. So if you can improve the way that the brain is functioning, it can also improve the way that the brain is sending signals to the body and the response rate of the body. So people find that their academic or their athletic performance can also be improved. Some of these have direct tie-in to traumatic brain injury or PTSD. So things like chronic fatigue, concussions is listed there. Depression symptoms can certainly be the result of PTSD or TBI. Fibromyalgia and chronic pain conditions, executive function we mentioned earlier. Focus and brain fog is a huge issue for a lot of individuals with both PTSD and post-concussion. Many of the people that I work with, one of the biggest things that they experience or that they talk about is just how foggy their brain is or how unclear their thinking is. And have seen some really significant gains in that, sometimes really quickly in a matter of a treatment or two, to some degree can help sort of clear that fog in a bit. You mentioned insomnia and sleep disorders, memory. Migraines is what I'll talk about in my next talk. So again, if that's something that you're interested in, we're just um, finishing up a paper right now on migraines, and we'll be able to dig into some of the mechanisms there and how it can be helpful. Um, Stress, stroke, Tourette's movement disorders. There's a number of other applications beyond that. But that's what I have for you. If you are interested in more information or you want to reach out, you can do so through my website, acuneuromodulation.com. My practice in Portland is the Neurogen Brain Balancing of Portland. It's an extension of DSW Health Services. Um, if you want more information about Neurogen as a whole or to look up practitioners not in the Portland area, uh, you can go to neurogenbb.com and it has testimonials and links to the research and things like that. And for veterans, if you're a military veteran or a U.S. military veteran, bb4vet.org is a nonprofit organization that will fund and pay for up to 4 neurogen sessions at no cost for veterans. Um, it's you have to go to the website, sign up for it, and they do ask for a testimonial afterward. But it does allow for access and free sessions for military veterans. So it's a fantastic resource, and people who work through that nonprofit can reach out to any neurogen practitioner across the United States. So it's in order to sort of get set up with the system. Part of the agreement is that you work with the organization or collaborate with the organization. So it is an accessible resource for veterans, which I think is absolutely fantastic. So that is what I have for you. I thank you so much.